COVID-19 crisis in India. I'm Sukant Khurana. I'm the founder of IonCure. IonCure is the next generation healthcare and drug discovery company with its roots in US, North America, US, Canada. We're trying to spread in Europe and also in India. So with us, there is Dr. Dipasri Konar. Dipasri is both a physician and a scientist. She did her MBBS medicine in India and then has gone on to do research in microbiology and thus epidemiology also. She has been working after several years in the US. She has been working in tribal areas of Chhattisgarh in India. So welcome, Dipasri. Thank you for joining us.
Thank you, Sukant, for giving me this opportunity. I'll try to shed some light on the situation we are facing today.
Sure. So thanks, Dipasri. So let me ask you a basic question. What is coronavirus? What is people's understanding of it?
So coronavirus is a large family of virus. It is not one virus per se. It's a large family. You know, like a virus is a structure which has a genetic material, either DNA or RNA, and then it's surrounded by a protein coat. It's like an envelope of protein, or should I say it's called capsid. Some viruses have a lipid coating on top of that, and some do not. Viruses like what we are seeing now, coronavirus, they have the lipid coat. So, coronaviruses occur widely in the environment. It is seen in mammals, it is seen in birds, and there are many coronaviruses that we know of. Since we are in close contact with animals around us, it has occurred throughout the times that some of the viruses may come from the animals to the humans or from the birds to the humans. So this is not an unnatural phenomenon. And what happens is that if we have the immunity to fight against it, that's okay. We'll have a simple, like what we say as viral fever, we have headache, we have cough and cold, common cold that we say traditionally, and we have pains in the body, aches and all those things, generalized symptoms, non-specific. So, but if sometimes we are threatened by a new virus for which our body has no prior experience. So the body doesn't know how to deal with it. So that's where we are now. We have had in 2002 SARS-CoV-1. So it's SARS, severe acute respiratory symptom. CoV is coronavirus 1. So in 2002, when we had the first news of SARS-CoV breaking out, due to the timely interventions of the health ministries, or as I say, the health officials of the country, which had the epidemic, and the WHO, it was largely controlled within that year. We did not have any more SARS-CoV-1. In 2012, we had MERS, Middle East Respiratory Symptoms, and that was also a coronavirus. We called it MERS-CoV. This was mostly in the Middle East countries. The outbreak was first in Saudi Arabia, and then it spread to Oman, UAE. Now MERS-CoV it's not totally eradicated, I would say. It's still going on, but the number of cases are too few. And thankfully, fortunately for us, it did not spread worldwide. So we have had two instances. This is not the first time we are affected by coronavirus. And then in 2019, we had another coronavirus. Now, this was also causing respiratory symptoms predominantly, severe acute respiratory symptoms, that's SARS, coronavirus, that's CoV, And then since we had a 1 before, now it became 2. And the disease is called COVID. Co for corona, VI for virus, D for disease. And the year is 19. So that's what it is about. So I guess that would give an overview of.
Refer to coronavirus, they should understand there are several coronaviruses.
Yes.
Some ranging from benign, some having very severe problems, some
That's
not even
correct.
affecting humans at all. So it has been in circulation for a long time, and newer ones coming. Now coming to this, how, basically, how is it spreading? What are the means through which COVID-19, SARS-CoV-2 is spreading?
Yeah. So when we are talking of spreading, we as of now know the most common route of spread is airborne. There are still debates going on, but if you ask people who are attending to patients and who are doing a lot of science regarding this, most will tell you that this is airborne. Now, what is airborne? Airborne is something that is mostly spread by droplet infection. When you and I, we are talking or sneezing or coughing loudly or maybe even laughing loudly, we have small droplets of saliva that are coming out of our mouth. We may or may not be aware. Sometimes the droplets are big and we are aware. Sometimes we are not. And the virus in a patient who is suffering from COVID-19, it will be laden in their droplets. So if we are very close together, closer than 1 meter, 1 meter is like a distance. If we are separated by a distance of 1 meter and I am talking very loudly or laughing or sneezing, the droplets will come out of my mouth. Either it will settle down on the ground if it's a big droplet, or it will travel maximum of 1 meter and settle on the person maybe if the person is nearby. So if it's a small enough droplet. Now these droplets are laden with virus. The droplet will dry. Either it will dry mid-air or it will dry when it settles down on a person or on the ground or wherever. The problem here is that we have seen even after the droplet dries, the virus is not inactivated. It retains its infectivity. So it's not that because the droplet is dried, the threat of the virus is over. So that we have to keep in mind. The second thing is that this is a direct spread from person to person. There's an indirect mode of spread. So, for example, if I'm sneezing on my hand, and then I shake my hands with you, you get it from me, get the virus from me. Or I've sneezed and have touched the door behind me, okay? And then I go around on my work, you come in, you don't know I have touched it here, you touch the same place. You touch something, I have touched this, the door handle, you also touch the door handle to open the door. You get the virus. So this is an indirect mode of spread because the virus stays viable for a long time. Now there is a third mode of spread which has not been very well established till now, which is via the gastrointestinal tract. Now this is a property of coronaviruses. It's not SARS-CoV only. It's a property of coronaviruses to spread through the gastrointestinal route, to be shed in the patient. Now this has, as I said, work is going on. We don't know that is it infecting anybody, but it can survive and be shed in the stool. We know that much. So that is as far as the mode of spread goes.
Wonderful. So, but yeah, I am really curious about gastrointestinal, and I do believe that it can spread, given that similar other viruses have spread this way. But obviously, more research needs to be done, and there are interesting claims of finding it in sewage, right? In a lot of places, and which even some
which
of them
would
even.
yeah, which would work for us on a community level, because like polio, we had sewage sampling. If we do the sewage sampling, we can very well know which area is infected, and in fact which house is infected too from there.
Absolutely. So, what should we do to sort of increase our safety?
So yeah, so there are many things to be done, simple things for the general population at large.
Mhm.
There are some steps that the health officials have to take, and the government of any country have to have laws to, and policies in place.
Mhm.
So I will mostly discuss on what's to be done by the general public, because that's most important. Uh, in, in, I know it's a political responsibility, but it's also an individual responsibility. So, as I said, that the route of spread is respiratory. So when I sneeze or cough, or I mean, you're in front of me, it can enter through the eye, the nose, and the mouth.
Mhm.
It cannot enter any other way. So if we can just protect the eye, the nose, the mouth,
Mhm.
then we have traveled more than half the distance in self-protection. When we are touching the door, as I said, I have touched it after I sneezed on my hand. You have touched it after you sneezed, after you did not know that I had touched it previously.
Mhm.
It will not per se go through the skin and infect you. You have to touch you have to touch your eye, your nose, and your mouth for it to get access to your body.
Mhm.
So, hand washing, hand washing, hand washing.
Mhm.
That's the mask.
Mhm.
Mask is, you do not need any fancy mask unless you are really close to patients and doing some medical procedures, on them. A simple cloth mask for everybody will
Mhm.
do. Goggles. Ideally, you need big, goggles covering your whole eyes. But even if you don't have that, that zero power glasses, the ones we have, even that will suffice.
Mhm.
When you're wearing the mask, it should cover your nose and your mouth. As I said, the virus will travel to your nose, your mouth, and your eyes. So mask is not only for the lips. Mask is not for your chin. It's for the nose and the mouth. So it should be a well-fitted mask covering your. If you do not have a cloth mask, you have a dupatta at house. You
Mhm.
have a shawl, like the thin ones. You can use that. But please do not go out
Mhm.
without some sort of covering.
Mhm.
Wash your hands as frequently as possible. Now, like, especially when I'm not asking you to wash your hands like every half an hour, because we are not used to that. We'll forget. But whenever you're coming home from outside, whenever you're in a public place and you're coming back, use a soap and water if you have nothing else. You do not need fancy sanitizers. If you have it, good, because if you have a small bottle of sanitizer, you can use it everywhere. But if you do not have, you have soap. At least use the soap. If you are caring for a patient with COVID, then you need to be more careful. You know, you need to have as little physical contact with the patient.
Mhm.
Sometimes even that is not possible, that you have to take care of the patient. The patient is not cannot take care of themselves. You're helping the patient. Always wear your mask. Make the patient wear the mask, goggles, and hand wash. So
Absolutely.
that's, yes. Now, for example, and what will So that's for the people who are caring for or the people not affected by COVID-19. Now, the problem with COVID-19 is that most of the population, over 80%, so if there are 100 people, 80 or more than them will have no symptoms at all. You know, you don't go to a doctor for a sore throat. You don't go to a doctor for a simple, body ache. So you won't even know that the person is harboring the virus, is infected. So that is why you cannot assume that just because you do not have severe symptoms, you're not infected with the virus, which is why it's very important for everybody to wear masks, wear goggles, and hand wash. You have to you have to always assume that, yes, I might be carrying the virus. So, because, I mean, we have so big burden of asymptomatic population. That is why we are having spread too.
Yeah, how much is the spread through asymptomatic people, we don't know. But for example, in our own team, one of our friends who you know well, Ronit Bhattacharya's mother today tested positive for COVID-19. So, and Ronit is the one who's going out to get groceries, not his mother. So Ronit might have asymptomatically carried it home. And since he's fit, he's in his early 20s and he's very fit, he may not have displayed any symptoms. While his mother, who's elderly in late 60s, is showing the symptoms. So these issues are there, and we don't know how much is the difference between symptomatic versus asymptomatic carriers, and how much is the spread. But yeah, masks are essential, and we have people who are trying to be macho, not wearing masks. There are people in US also trying to do the same. It's rather unfortunate. So I'll finish it with the last question. What is that as a physician? What are the additional challenges that you are facing as a physician as a result of COVID-19?
So we are facing unique challenges that is not written in the medical books. We never expected to see a pandemic in our lifetime. As I said, there was MERS, there was SARS. I thought we would be smart enough, but we weren't. We missed, and now it's out of control. The challenges are medical, social, political. I mean, anything you can think of. So, medical is, we still do not know the disease in its entirety, because it's a new disease. So, every time, like, new symptoms, new problems, which we have not, like, I would expect a patient to come with me with pneumonia-like symptoms or influenza-like symptoms, or, like severe respiratory illness, to even think that this person is COVID-19 positive. It might not be so. Patients are, this virus has the tendency to affect people with long-standing chronic diseases, lung disease, kidney disease, diabetes. So people are coming for kidney failure, liver failure, and then you suddenly find out when they are being tested that they have SARS-CoV-2. So this is a challenge we are facing. There's always a challenge of good quality, finding good quality PPE, personal protective equipments. We have to invent innovative ways to reuse those that we have, whatever we have. There is still no drug or vaccine in place. It will take time to come to the market, and we do not know even if there is an assurance that it will come at any point of time. So I would like also to tell you that in India, the projected mortality rate for non-healthcare workers is 2.7% around, 2 to 3%, take it or leave it. For the doctors and other nurses and other healthcare workers, it's 11% from COVID.
That's shocking. Yeah. Yeah. So
Yeah.
the government of
And,
India needs to
yeah.
get in PPE. That's the least they
Yes.
can do, and that's not
Yes.
happening.
Yes. I would also like to see the social problems. There is so much misinformation among people through all the social media handles that you can think of, that it's like what it was, we would have leprosy patients and you would be excommunicated from the society. COVID has become the new leprosy. And if you come to know, it's like, oh my God, this person has COVID. Okay, there's no like sort of empathy or even sympathy that the person is going through a hard time. People are making that poor person's life even harder. So what happens due to this is that people hide their symptoms.
Yeah.
They don't want to, tell that I have got the symptoms. They don't want to have they don't want to be labeled. Their families are being harassed if people come to know about it. The healthcare workers are being harassed that you deal with COVID patients, hence you're carrying COVID, hence you cannot come. So we have to be a little more aware, and we have to be more, I would say, social. This is very sad that a person who is always, and I see patients whose children are living like maybe in other countries, and they are worried stiff that like we don't know what's going to happen to our parents. And here the elderly parents, it's hard enough that they are fighting with such a disease. They have to fight the community at large, who's trying to get them expelled. So this is very disheartening. The least you can, like, if you cannot do any good, don't do any harm. You just, just keep yourself safe from, if you think that person is suffering from respiratory illness or COVID or whatever, keep yourself safe. And if the person is wearing a mask and, standing 1 meter away from you, you're reasonably safe. Make sure you're washing your hand. Make sure you have your eyeglasses in place. So that's one thing. About the, I would say from the hospital administration's point of view, I have to say it with a heavy heart that we are not where we should be. The least we should do is we should have an open place where most of the places we are segregating patients with fever, respiratory illnesses or cough, whatever, from the rest of the patients. But, they should be kept in a large open space. The waiting, we cannot have congested waiting rooms. The administration has to take, you were telling something, Sukant?
No, I agree. But these are issues of, 70 years of mismanagement, which is continuing no matter which government is coming in, at state or center in India. And you go to hospital, it almost feels like you're going to die, right? When you're severely sick in India. As a patient and as a physician also, situation is not great. You are better aware than me about the physician density per population, and it really drops precipitously when it goes to poor regions, interior of the country. So the conditions are horrible, and when somebody falls sick, they don't want to go to a government hospital. The moment they get in a private hospital, they can go bankrupt with a disease. So
yes,
it's a very pathetic situation.
Yes, it's a very sad reality. And without naming, there's a government hospital who is not even following the government guidelines of testing, leave alone, like I have seen them sending patients of severe acute respiratory illness diagnosed back home that we will not test you because you're a diabetic. It must be because if we have a patient who has difficulty breathing, who has influenza-like symptoms, you cannot just send the patient home because their take on it is because the patient has some underlying condition, that must be the cause of the distress, not anything else. So we will not even test the patient. And you cannot reason with them. And this all is word of mouth. It's not like written anywhere. So what happens, and we all know this happens, is that some orders come written and some orders are verbal. The written order gives you all the nice things and all the proper things to be done, but overriding is an oral order that all this is written on paper, that's okay, but we will not do it. We'll have our own policies, we'll have our own guidelines. So it becomes very difficult to negotiate such situations. And this is unfortunate, this is happening. I mean, I'm sure it's happening in a lot of places.
Oh, absolutely. Even in Delhi, where I'm based, there is a lot of blame game. It's like a tennis match where the center is trying to throw the ball in state's court and state is trying to throw the ball in center's court, and neither of them wants to take responsibility. So,
so that's the political aspect I was talking about. Yes.
Yeah. So there is a. But
there's
whatever you
another
said,
sad take on it. Okay, just go ahead. I keep on talking. Just go ahead.
No, it's very useful. So I was saying that important things of how it is transmitted, how people need to wear masks, how in hospitals we are short of PPEs, what we can do with, I think, better testing, what we can do with precaution, what are the viruses. So this is, I mean, people, empowered people anywhere, everywhere, whether it's India, whether it's USA, they'll result in better management of a crisis. So we can't change government overnight. In India, I don't think changing any political party is going to change too much outcome in any short run. But we can make people aware. That's at least what we can do. And I think that's been very useful. So go ahead and let's try to.
So, you know, awareness begins at the grassroots level. I mean, even teaching, even like something as simple as teaching that don't cough like this, don't cough like this, instead cough like this. It's very hard to teach people because culturally we cough like this, or we have a handkerchief to cough on. So, like, even when you're working, to come, for surfaces to come in touch with your hand or your forearm, the probability is much more than your shoulder and your upper arm. So if we cough like, there's very little chance that will spread to the surfaces. But something as simple as this can make so much of a difference. But it's very difficult to inculcate this in popular culture. You have to start this in school, actually. But there are so many school dropouts. So that's a different problem altogether.
School dropouts, school teachers not teaching. But I was at a drug discovery institute. Forget school teachers not being there. Even directors of drug discovery institute are not in there. You try to find where they are. They're having beer and kebabs while teaching Ayurveda and bullshit lectures. So, so India as a whole, I hope. Just like
every place, there is no utopia on this earth. Every place has its own problem. If there was a utopia, we would all go live there. There is nothing such as, no society is perfect. So we have to do with whatever we have, and we have to style innovative ways to get through the problem.
I agree. That's on a positive note. There does not exist a utopia.
And let me tell you, like, COVID is a socio-economic problem as well, or should I say socio-economic political problem. Why? One, the poorest people are the hardest hit. We all know about this. We have seen what happened to the migrants.
Two, second-grade citizens or third-grade citizens, the way they were treated.
To the Facebook India, they are, they are dispensables, it seems.
Yeah.
Two, healthcare resource allocation is not uniform in the country. The rural sector gets a lot less resources than the urban sector. But we must also never forget that 66% of Indians live in rural India. And the resources are very less, very poor. So when you have something like COVID, we are already dealing in rural India, we are already dealing with so many problems. And to accommodate one more problem, it becomes impossible.
Yeah.
We do not have even the cities, even the city like Mumbai, even a city like Delhi, they are grappling with ventilators, shortage of ventilators. Imagine what happens in a rural setup. There are so many hospitals without ventilators. Imagine what happens. And then you have policies in place that is well suited for the cities, but not suited for the rural India. So, at times like this, rural India, till now, most of the infections, about 50% of the infections have been reported from 5 to 7 cities in India. Rural India has not been that badly impacted because of a variety of reasons. I do not know if that is the truth, because rural India is also doing testing more poorly than the rest of India, the urban India. We also, and even if I think that, okay, rural India is not being affected by COVID so much more, then why are we allocating so much resources to COVID and neglecting the other diseases?
Yeah, and
so for example, every day in India, 700 people die of tuberculosis. If we were as worried or as vigorously working for tuberculosis worldwide as we are for COVID, tuberculosis would have been a history lesson by now. Every year, 3 lakh people worldwide die of pneumonia, of influenza, sorry. We have a vaccine, and so many people cannot afford the vaccine.
Absolutely.
So because these are diseases, like something like COVID is a disease which is democratic. It affects all strata of society. Therefore, there's so much hue and cry. But in countries where tuberculosis is rampant, influenza is rampant, and no vaccine for influenza for the poor masses, hence not so much. That's good, Sukant. You did sneeze right. Yeah. So, okay.
This is an old.
Yeah, you were asking a question.
So, having lived in Texas for 10 years, I think it did teach. They did take a lot of.
Yes, they do. They do. Yes, they do teach.
Yeah.
Yeah. So, what was your question? You were about to ask something.
Yeah. So, I was just actually intervening that there is going to be a sort of a feed-forward effect with not enough water logging cleaned up because of sort of lockdown. There is going to be more cases of malaria. You have already told me, it's not an insight I'm sharing with you. It's I actually learned from you how people from tuberculosis could not come and visit hospitals. So there is going to be that effect. And in the wake of COVID-19, in case of SARS-CoV-2 infection, there are a lot of people who are becoming diabetics, type 2 diabetics. The people who are being left with glassy lungs. So there is fibrosis, there are organs are going to be weak. So there is going to be huge sort of consequences.
We had so many patients with HIV coming to us. They would usually go to the government facilities, but since the government facilities were looking only after COVID and not after other non-COVID diseases, not their focus was on COVID, is on COVID. These patients had nothing else, they did not have an option. They went to like other hospitals, which they would not go otherwise. And you know, when you go to a private sector or even an NGO, you have some amount of money that you have to pay from your pocket. So that's hard on them.
Yeah, so there is going to be a lot of feed-forward effect, and there is huge effect on economy. The reason is COVID-19 took so much of the interest of government is because a top lawyer, a top judge, top industrialist, or a prime minister of country can die with equal probability as a poor vegetable vendor. That is why they have clamped on it so much.
And we cannot have that, right? We cannot have them have the same disease, die from the same disease. Such a shame.
Yeah, so if tuberculosis is not something which affects your and my strata of middle class, definitely not upper middle class or upper class, and so government doesn't care as much.
Yes.
So that's a sad reality of India. So there are not utopias, but there are dystopias which can be made better. But, anyway, so Dipasri, thanks a lot for your time. Wonderful insights. If you want to recap everything in 1 minute, please do so, and then we'll end the show.
So COVID-19 is big. It's the top news now. But I want to say everybody that you need not be afraid. Just take care of these simple steps. Be a responsible citizen. I cannot go out and ask the government to change policies. I can only do so much at the hospital level, but I can ask my fellow citizens to do their bit. So that's what I'm saying. There are larger, more, this doesn't even have the highest mortality, and the mortality is also going down. There are other big killers, but you can keep this disease at bay. You can take care of yourself. That's what I want to, that's what my message would be.
Wonderful, Dipasri. It was a pleasure having you. We'll sign out for today, and hopefully people learn a lot.
Thank you, Sukant.
Thank you, Dipasri.
Thank you.